We'll start with the less savory methods and work our way up to the truly revolting. Buckle up, because this journey through history will leave you both fascinated and horrified. Number 1. Pig toilets. At first glance, the concept of pig toilets might seem like something out of a cartoon or a surreal dream. But these were, in fact, a real and incredibly unappealing invention from ancient China. Imagine a toilet that didn't just handle human waste, but used it as a feeding opportunity for pigs. The setup of a pig toilet was straightforward yet stomach-turning. An outhouse was constructed over a pigsty, with a chute or tube connecting the two. As people used the toilet, their waste would flow down into the pigsty. The pigs, ever eager for a meal, would consume the waste, which was then digested and converted into fertilizer. The intention behind this design was efficient waste management. By recycling human waste through pigs, it also provided additional fertilizer for crops. However, the system had several significant drawbacks. The odor was reportedly unbearable, creating a pungent stench that was difficult to ignore. Furthermore, there were serious concerns about animal welfare and hygiene. The close proximity of humans and pigs meant that diseases could spread easily between species. Pigs could pick up parasites from human waste, which could then transfer back to humans, creating a vicious cycle of infection. Contaminated groundwater and environmental pollution were also potential risks. Despite these issues, pig toilets were still in use in some parts of Asia as recently as the early 2000s. One can only wonder about the pigs' perspective. Did they recognize the waste as food? Was there any excitement among them when someone walked into the outhouse? The concept certainly raises a lot of questions about historical sanitation practices and the lengths people have gone to manage waste. Number 2. Wigs and their lice epidemic. Wigs were all the rage in 17th and 18th century Europe, and while they might have looked fashionable, their hygiene was anything but. Wigs were rarely washed and became perfect breeding grounds for lice and other pests. Imagine placing a lice-infested nest on your head every day as part of your morning routine. The use of wigs was widespread, serving multiple purposes. They helped cover up hair loss caused by diseases such as syphilis and allowed people to sport different hairstyles without the need to wash or alter their natural hair. During that era, frequent hair washing was uncommon, making wigs a less than ideal breeding ground for lice. Wigs were often fitted snugly against the scalp, creating a dark and warm environment that lice found irresistible. Some wigs were made from horsehair, which carried lice from the horses directly to the wig wearers. To mask unpleasant odors, people used perfumed powders, which, unfortunately, only attracted more lice. Even though modern hygiene practices have evolved, it's hard not to cringe at the thought of the lice-ridden wigs worn by people in the past. Perhaps if wig wearers of yore had invested in a good wig rinse or shampoo, their lives and heads might have been a bit more comfortable. Number 3. Urine as a facial cleanser. Imagine waking up one morning, running low on your favorite facial cleanser, and deciding to use urine instead. It sounds unbelievable, but using urine as a facial cleanser was a common practice in various cultures throughout history. In medieval Europe, fresh water and perfumes were scarce, so people turned to urine as a substitute. The ammonia in urine was believed to have cleansing properties, making it a go-to for those looking to freshen up. Ancient Chinese medicine also included urine as a treatment to help regulate balance in the body. Similarly, the Romans saw urine as an effective cleansing agent and used it not just for their faces, but for cleaning clothes and floors as well. What's even more surprising is that the wealthy elite in ancient Rome used urine from public urinals for their hygiene practices. While common people used their own urine, the upper class preferred the stronger, more potent urine found in public spaces. It's difficult to fathom how people reconciled the idea of using someone else's urine for personal care. The concept of using urine for cleaning purposes might seem outlandish, but it reflects a fascinating aspect of historical resourcefulness. While modern alternatives have made these practices obsolete, it's intriguing to consider how people historically dealt with their daily hygiene challenges. Number 4. Urine as mouthwash. If you thought using urine as a facial cleanser was strange, wait until you hear about its role as mouthwash. Historical evidence suggests that urine was used as a mouthwash by various cultures, including the Romans, Chinese, French in the 18th century, and some ancient Indian societies. The ancient Romans, in particular, prized urine for its purported antiseptic properties. The philosopher Seneca, known for his philosophical wisdom, also endorsed this practice. For the Romans, urine was a versatile substance used for numerous purposes, including cleaning and dental care. The Chinese and Indian cultures added herbs to urine to make the mouthwash experience more bearable. In ancient Indian medicine, cow urine was favored due to the cow's religious significance in Hinduism. Cow urine, along with dung, was used in various health practices, and even today it's still employed in some traditional remedies. The idea of using urine as a mouthwash, while seemingly revolting by today's standards, underscores the historical quest for effective and available hygiene solutions. Despite modern advances in dental care, it's fascinating to see how different cultures approached oral hygiene in their own unique ways. Number 5. Mouse brain toothpaste. The Romans were known for their intricate dental care, but their toothpaste ingredients might make you reconsider your next dental checkup. Ancient Roman toothpaste recipes included charcoal, crushed oyster shells, bones, and even human urine. However, the most unsettling ingredient was crushed mouse brains. The Romans believed that adding mouse brains to toothpaste would enhance its effectiveness and freshen breath. They mixed these ingredients into a fine powder with a binder, often honey, to create a paste. While the idea of brushing with a concoction of mouse brains and urine might sound revolting, it's worth noting that Romans had relatively good dental health for their time. Archaeological evidence from Pompeii and Herculaneum shows that about 1/3 of the population had missing teeth, and few exhibited severe dental issues. Despite their unorthodox ingredients, the Romans may have been onto something with their innovative dental care practices. Number 6. Crocodile dung contraceptive. Now, let's dive into one of the most unappealing contraceptive methods ever devised: crocodile dung. In ancient Egypt, crocodile dung was sometimes used as a form of contraception, according to the Ebers Papyrus, an ancient Egyptian medical text. The ancient Egyptians mixed crocodile dung with fermented dough made from water and plant materials to create a barrier method. The dung was chosen for its availability and cultural significance. Crocodiles were revered in Egyptian mythology, and their dung was readily accessible. However, the use of animal dung as a contraceptive came with significant health risks. Inserting dung could introduce harmful bacteria and pathogens, leading to infections and other complications. Despite its intended use, crocodile dung was not the most hygienic choice for birth control. Number 7. The Roman vomitorium. Contrary to popular belief, a vomitorium was not a place where Romans went to vomit between courses of a feast. However, the act of deliberately vomiting to make room for more food was indeed practiced among the Roman elite. This behavior was a reflection of the excessive indulgence that characterized Roman banquets. The term vomitorium actually refers to the passageways in Roman amphitheaters that allowed crowds to exit quickly, but the notion of overindulgence and purging was a reality in ancient Rome. Some accounts suggest that the Romans used feathers or other tools to induce vomiting, allowing them to continue eating during their elaborate feasts. The idea of intentionally purging to continue eating is disturbing, especially considering the extreme contrasts between the lavish lifestyles of the elite and the widespread poverty in ancient Rome. Number 8. Snail slime as a beauty treatment. The use of snail slime in beauty treatments might seem like a modern fad, but it has ancient roots. The Greeks and Romans used snail slime as a remedy for burns, inflammation, and skin conditions. The slimy secretion of snails was believed to have healing properties, and it was applied to the skin to reduce redness and irritation. Today, snail slime is still used in some skincare products, touted for its moisturizing and anti-aging benefits. The idea of spreading snail slime on your face might be off-putting, but it's a practice that has endured for centuries, proving that some ancient remedies continue to have relevance in modern times. Number 9. Bloodletting for health. For centuries, bloodletting was a common medical practice believed to cure a variety of ailments, from fevers to headaches to even mental disorders. The practice involved draining a certain amount of blood from a patient, often using leeches or a lancet, with the belief that it would balance the body's humors and restore health. Bloodletting was based on the ancient Greek theory of the four humors: blood, phlegm, black bile, and yellow bile. An imbalance of these humors was thought to cause illness, and removing blood was seen as a way to correct this imbalance. Despite its widespread use, bloodletting was often more harmful than helpful. Patients could become weak, anemic, or even die from excessive blood loss. It wasn't until the 19th century that the practice began to fall out of favor as medical knowledge advanced and more effective treatments were developed. Number 10. The plague doctor's attire. The iconic image of a plague doctor with a beaked mask is both fascinating and terrifying. During the Black Death in the 14th century, plague doctors wore these distinctive masks, which were filled with aromatic substances like lavender, mint, and camphor. The belief was that the miasma, or bad air, caused the plague, and the herbs would protect the doctor from infection. The long-beaked mask also served as a form of social distancing, keeping the doctor's face away from the patient. The rest of the outfit included a long waxed overcoat, gloves, and boots, all designed to minimize exposure to the disease. While the plague doctor's attire was an early attempt at personal protective equipment, it was based on flawed medical theories. The outfit, with its eerie appearance, has since become a symbol of death and disease in popular culture. Number 11. Egyptian eye makeup. The ancient Egyptians were known for their elaborate eye makeup, particularly the use of kohl to line their eyes. But this wasn't just a cosmetic choice, it also had practical and religious significance. The kohl, made from ground minerals like galena and malachite, was believed to protect the eyes from the harsh sun and ward off infections. Interestingly, the lead-based kohl also had antibacterial properties, which may have helped prevent eye infections common in the hot, dusty environment of ancient Egypt. However, prolonged use of lead-based makeup could also lead to lead poisoning, making this beauty practice a double-edged sword. The iconic look of Egyptian eye makeup has endured through the centuries, influencing modern beauty trends and remaining a symbol of the sophistication and mystery of ancient Egypt. Number 12. Tobacco smoke enemas. One of the more bizarre medical practices in history is the tobacco smoke enema, used in the 18th century as a treatment for drowning victims. The practice involved blowing smoke into the rectum using a bellows, with the belief that the nicotine would stimulate respiration and revive the victim. Tobacco was thought to have medicinal properties, and the smoke enema was used for various ailments, including headaches, respiratory problems, and even constipation. However, the practice fell out of favor as medical understanding improved, and it became clear that tobacco smoke was more harmful than helpful. The tobacco smoke enema is a reminder of how far medical practices have come, moving from superstitious and often dangerous treatments to more scientifically grounded approaches. Number 13. Maggot therapy. Maggot therapy might sound like something out of a horror movie, but it's actually an ancient medical practice that has made a comeback in modern medicine. The use of maggots to clean wounds dates back to ancient times, with references found in the Bible and in the writings of early physicians. Maggots are used to debride or clean necrotic tissue from wounds, as they feed only on dead tissue, leaving healthy tissue intact. This method is particularly useful for treating chronic wounds, such as those caused by diabetes or poor circulation. Despite its effectiveness, the idea of maggots wriggling in a wound is unsettling to many people. However, maggot therapy has been shown to be a valuable tool in modern wound care, demonstrating that some ancient practices still have a place in contemporary medicine. Number 14. Honey as an antiseptic. Honey has been used as a natural remedy for thousands of years, with its antiseptic properties making it a valuable treatment for wounds and infections. The ancient Egyptians used honey in their embalming process and as a topical treatment for wounds, while the Greeks and Romans also recognized its healing properties. Honey's antibacterial qualities come from its low moisture content and the presence of hydrogen peroxide. It creates a protective barrier over wounds, keeping them moist and promoting healing. Even today, honey is used in some medical settings to treat burns and ulcers. The use of honey as an antiseptic is a testament to the wisdom of ancient medical practices, many of which continue to inform modern medicine. Number 15. Cannibalistic remedies. Perhaps the most shocking of all historical practices is the use of human body parts in medicine. Known as corpse medicine, this practice was common in Europe from the Renaissance through the 18th century. Human bones, blood, and fat were believed to have healing properties and were used to treat various ailments. Mummified remains were ground into powder and ingested to cure headaches and stomach ailments, while human fat was applied to wounds to promote healing. Even blood was consumed as a remedy, with fresh blood from executed criminals considered particularly potent. The practice of corpse medicine was based on the belief in the doctrine of signatures, which held that the properties of a substance could be inferred from its appearance or origin. This led to the macabre use of human remains in medical treatments, a practice that is thankfully long abandoned.